Hello, everyone, and welcome to Time with Dr. Racheal. Today, we're going to be talking about the male reproductive system and the testes, to be specific. What is the testis? It's just the main part of the male reproductive organ. They are found in twos, that you have two breasts, you have two testes. What is that? That's two organs. They're round, they're like balls, like tennis balls, found within the sac, which is right there down below the male reproductive system. And what do? They're responsible for producing those sperms, yes, and they help with producing this hormone that we call testosterone that makes the men, the boys, the hair, everything that is masculine. So I call it the masculine gut, the masculine organ. So why testes today? So we're focusing on testicular cancer. It's not a very common cancer, but guess what? It is very common in men that are between the ages of 20 to 30. In fact, on average, let's say 33 years. And that's why it's so important to us, because that's also the prime time of the reproductive age of a man. And what could make you predisposed to having testicular cancer? Either there's a family history of testicular cancer, or it just happens. Or the fact that it's a young adult man. So you see, these things happen. But how can you tell? How can you find out? You may just feel a bump on the testis, that is on the balls. You could just feel a lump or a bump on it, and most of the times it's painless, and there's no other symptoms. Sometimes you may feel lower abdominal pain or heaviness down below. You just feel like a dragging sensation around that area where the testes are found, and that could just be all. When you feel anything like that, you need to go straight to your doctor and have yourself checked. And I would like to talk about how can you actually feel to know that this lump exists. Usually you could find out while you're having your bath or you're using your body cream and all of that. And then you run your fingers slightly round the testis. You could just feel like a bump or a lump. And sometimes it could be hard, but honestly painless, and you could miss it. There are other things that could be like that. It may not be cancer. It may just be like a cyst, maybe an epidermal cyst, just some kind of benign growth that happens and self-limiting. So, but for you to know truly if whether you have testicular cancer or not, if you feel any of such symptoms, please go straight to your doctor and have yourself checked. Or if there's a family history of such, please just go straight to your doctor and have yourself checked. Now, how can we prevent it? Testicular cancer? I'm sure you'll be wondering. Okay, so doctor, you talked about testicular cancer. How can this be prevented? Sadly, there's really no defined way of preventing this cancer correctly. And we don't even have specific screening guidelines. But what we have right now is it's more like a self-driven check. What do I mean by this? If you had family history, then you need to have a very high index of suspicion. You're between the ages of 20 to 30, 33, an average of 33 years old. That means you need to know how to check for the lump. And how do you check for a lump or a bump in the testis? While you're having your bath, it's said that at least once every month, while you're having your bath, you just run your fingers gently round your testis and feel for any abnormal bump or lump or change in the way it feels. And if you feel any of such, then you need to go straight to your doctor so you can have a consultation. Of course, you may need to do some investigations like an ultrasound, of the testis and all, and to rule out any possibility of a testicular cancer. Testicular cancer is common in the men of reproductive age group, and it's very important that you get yourself checked. And if you find anything wrong, please go and see your doctor. We all know that cancer is an abnormal growth of cell and it can result to cell death and affect other parts of the body and subsequently lead to death. So it's very important that you check your body, you understand your body, and you're able to identify when there's anything wrong with you and do something about it. It's so important that you get yourself checked, and if you find anything wrong, go to your doctor. Stay tuned, subscribe to our channel, turn on your notification button, press the like button, and we will have more to you when we come back. See you later.